Let me start with the Waikato. While we've continued to see cases here, which represents a likely long tail, these have remained linked. We've had no unexpected wastewater detections and testing rates are high. Vaccine levels are also providing an extra layer of protection. That's why the Director General of Health has recommended another easing of restrictions in the Waikato, allowing them to take the second step down in level 3 from tomorrow, Tuesday the 2nd of November at 11:59 p.m. The end goal for Auckland, and indeed the country, is the new COVID-19 protection framework. And of course for Auckland, that will occur once we hit 90% in the 3 DHBs in Auckland for the eligible population. In Auckland, we are now fewer than 5,000 first doses away from cracking that 90% goal for first doses. That's a tremendous effort over the past couple of weeks. It means that we are fast becoming amongst the most vaccinated countries in the world. And to Tamaki Makaurau, we thank you for those efforts. But those vaccination rates also offer us greater protection now too. And we have said we would factor that in alongside the outbreak to make a judgment around any changes in the near term. In Auckland as a whole, 80% of the eligible population has now had 2 doses of the vaccine, and that's incredible. Case numbers, while growing, remain within some of our expectations as modelled. And the public health assessment of the impact of changes like opening up retail include that this activity is generally not responsible for marked increases of new cases. On that basis, after a discussion with the Director General of Health, Cabinet has taken an in-principle decision to move Auckland to Level 3 Step Down 2 from next Tuesday, the 9th of November at 11:59 p.m. A reminder again that this means retail can return, public facilities can open, and gatherings outdoors, again, outdoors, can increase to 25. For those concerned that we have not eased immediately, our approach is to take a steady and conscious change in our restrictions. We have only recently returned students into senior school, and this allows these changes to bed in carefully. For those who have concerns about any easing, here I would say that because of high vaccination rates in Auckland, we can move forward with greater confidence, and we will continue to have very strong and clear public health guidance on how businesses that are eligible to reopen do so. These decisions are carefully balanced and allow us to release some of the pressure and fatigue that we know exists in Auckland while we continue to vaccinate and prepare for the new framework where much more certainty will exist for everyone. We've heard the calls to try and do as much as we can to contain the outbreak in Auckland and the Waikato as much as we can. We discussed ways today that we can further add protections, including off the back of calls from the South Island to use vaccine certificates more readily to try and prevent cases moving from north to the south. While I have no further announcements today, it is something that we are looking into further. But I want to reiterate something that we've said for some time now. The boundary that we have now and the work that Auckland has done to contain the outbreak to where they live and work has given us time, but we will not be able to contain it forever. Despite huge efforts and at considerable cost to many who have foregone travel and connections, we have seen cases emerge, and even with further tightening, we are likely to see them in the future. We will continue to try and extinguish these cases, but I don't want anyone to be left with the belief that we can keep Delta in one place, and one place only, for good. Auckland has given us time to vaccinate, and we must take it urgently. To finish today, I want to give a reassurance. The team of 5 million has done an incredible job. We are in a transition right now, though, and that is tough. There is a huge amount of new information and a lot of change, and all of that is happening while everyone is quite frankly tired of COVID, and I know this can create anxiety. Today we wanted you to see some of the information that we see and to have the same reassurance that for all of the change that we are going through, New Zealand continues to do really well in tough circumstances and continues to move forward. While this time is hard, really hard, I still believe the same thing now that I believed in the moment we first took decisions on how to manage the pandemic, that we don't need to be afraid. We have more tools now than we did when we started, and we have a strong plan on how to use them to protect ourselves and minimise the impact COVID has on our lives. And ultimately, despite how hard everything feels right now, we are going to be okay. We just need to keep moving.
75% of eligible New Zealanders are now fully vaccinated, and we expect 80% or so to be in that situation next week. Auckland has already achieved 80% of eligible people fully vaccinated, and these are very significant milestones. If you recall back at the outset of our program, you will well remember that 70% coverage was a figure that was being bandied about internationally, and for us to achieve 80% of our eligible population 12 and over already fully vaccinated is fantastic. There are, as our statement said at 1 o'clock, 162 new COVID cases to report in the community today. 156 of these are in Auckland, 5 are in the Waikato, and there is 1 in Northland. There are also 4 new cases to report in recent returnees in managed isolation. Today there are 53 people in hospital with COVID-19, all are in Auckland, and just 3 of those are in ICU or a high dependency unit. Of the 5 new cases in Waikato today, 1 is in Ngaruawahia, 2 are in Otarahanga, while 1 is in Hamilton. There is a 5th case in Otarahanga that was announced yesterday but came in after our daily cut-off, so is included in today's numbers. That particular case is still under investigation to determine any links to existing cases. 3 of the 5 cases in Waikato today are already known to have contacts. In fact, they were isolating already, and the other one has also been linked to the outbreak there. There are no new cases to report in Christchurch today. There are 4 household contacts of the person who travelled to Tonga and was reported as returning a positive test. All 4 of those household contacts, as you may know, have been tested and returned negative tests. They remain in isolation for the time being, and we continue to work closely with our counterparts in Tonga to investigate the person who returned the positive result there, including to see whether that could be, in fact, an historical case. As you're aware and have seen over the weekend in particular, the cases are increasing there in Auckland. And here we've got a graph that shows what is really the epidemic curve in Auckland. So we could see that initial very high number of cases that came right down and then has steadily increased over the last few weeks. The orange line is the epidemic curve, and I should point out there are copies of these slides that will be available to everyone afterwards. Of note is the blue bars at the bottom of the graph, and you can see those are the hospitalisations. And whilst our case numbers are increasing and have got up to quite a high level over the weekend, we can see the hospitalisation numbers are not increasing at the same rate. And in fact, a number of those people in hospital are in hospital for reasons other than COVID-19. They happen to have a diagnosis of COVID-19 as well. And importantly, as you've seen, the number of people requiring ICU or HDU level care has really remained quite low. Of concern in the current numbers is that we've seen an increasing proportion of cases that are Māori. It was less than 10% of cases initially in August, but is between 40 and 50% of new cases each day now. Likewise, in counterpoint to that, the high number of Pacifica cases at the outset of the outbreak has now dropped down. In response to this, we've seen a very good response by our Māori people in Auckland to testing, and around 12% of Māori in Auckland have been tested in the last 14 days, so this is very important for us being able to identify any cases there. We've also seen a slight increase in the positivity rate up to 0.6%, whereas previously the highest point in September was 0.4%. I should say that the WHO suggests anything under 3% is what we should be aiming for, and our positivity rate still remains one of the lowest, if not the lowest, in the OECD. Most of our cases are young. The average age of the cases in this outbreak is around 30, and this is particularly true for our more recent Māori cases. Moving on to the next slide, we get asked every day at these stand-ups and we talk about the R value. And What we've got here is some modelling that's been developed by the Northern Region Health Coordination Centre, in particular Dr. Gary Jackson, who's at Counties Manukau DHB. And we're mapping here the actual case numbers on a 3-day rolling average, that's the blue line, and just showing projections for where we think the case numbers are likely to go, with also showing the impact of vaccination. You can see that at the moment that blue line is, as we've been saying, very much almost right bang in the middle between R values of 1.2 and 1.3. And you can see that if those vaccination rates weren't increasing, what would happen to those case numbers, but we can also see the impact that we're expecting, and we're already seeing our vaccination rates having there. The numbers in this slide, and you will get a copy of this, just show again the extrapolation of that modelling and looking at the number of cases per week to also look at what impact that's going to have on hospitalisations and on ICU beds. And in the last week, and that's the table at the below there, you can see that actually the number of cases was less than the modelling had shown. There were more new hospitalisations, and putting that down to that there are a number of those cases that are people with COVID but not necessarily admitted to hospital because of their COVID symptoms. But also you can see that ICU occupancy is below what the model might have suggested. So again, we're seeing this is because of two things really, the young age of those admitted to hospital, but also very much the impact of vaccination. And you can see here, and we've talked about this, that even now with those high vaccination rates, we're still seeing most of our cases are amongst the unvaccinated or partially vaccinated. And this is also the case for hospitalisations, which is on the next slide I'll show you. But just to point out here, as you see in every country, and it's happening here, as you get high vaccination rates, an increasing proportion of cases will be people who are fully vaccinated. However, the protection that vaccination offers from either becoming a case in the first place or being hospitalised because of that illness does remain really high. It affords a very high level of protection. And here you can see, again, the impact of vaccination on hospitalisations is even more profound. So we're doing well on vaccination, but 90% is a milestone. It's not the end point. We must keep our efforts going, and we really need vaccination rates up amongst all aspects of the population, all groups in the population. I really want to emphasise here too, not only does vaccination protect individuals and families and prevent hospitalisation and death, but it also frees up and makes sure our health system is available to deliver the full range of care that all New Zealanders need. There are 300 places available from today in the MIQ for health workers who are, or critical health and disability workers who are overseas. We are running a process as the Ministry with DHBs and other key health sector organisations to prioritise those places so that we can help fill some of those critical roles and improve and reduce some of the pressure on the health system.
You can see from what we've just shared that while cases are growing, vaccinations have the ability to keep numbers down overall, and importantly also to keep our hospitalisations down, and in fact they already are. Overall, that means as vaccination rates go up, our risk assessment of cases can change. As you know, we want to be very careful about this shift in approach, and it is a shift. Previously, we worked very hard to eliminate every case. It was a simple strategy, and that one we could all and did all get behind. But while Delta has forced us to change our approach, vaccines mean we can still have very similar goals to protect people and minimise the impact of COVID. The best way to do that is to hit the 90% vaccination levels amongst eligible people across each DHB before we move to our new COVID-19 protection framework, where everything from gatherings and hospitality comes back on stream, and where we remove large-scale blanket lockdowns.